Is it possible to get breast cancer but not feel any lump at all?
Absolutely. That's why we say it's screening.
So women younger than 40, how do you think they should examine themselves? How often should they examine themselves?
There is something called self-breast examination. In Tamil, we call it as Marbaha Suya Parisodhanai. You can examine your breast after the age of 25 every month.
That breast cancer does not occur just in women. Is that true? There have been some rare occurrences.
Yes, of course. We have male breast cancers also. There are so many people, who even on the day of surgery to skip the morning coffee is the biggest punishment for them. As soon as they are awake from anesthesia, they would say, I want coffee back. Just to have that. And we talk so much about cancer, though, so I am sure your followers must be panicked by now. But I also want to give them a very positive thing that 8 out of 10 lumps, are non-cancerous. Oh. So you don't have to worry.
Salute to your strength, doctor, because just having this one conversation is like touching me in so many ways. To be able to do this day in and day out, you must be an incredibly strong lady. Hi, எல்லாருக்கும் வணக்கம். Virtual hugs to all of you. Welcome back to my channel and thank you so much for choosing to watch this video, especially this video, because I know this is very important and it's the need of the hour னு கூட சொல்லலாம். Something that has become so common that நம்ம எல்லார் வீட்லயும் நம்ம எல்லார் குடும்பத்திலயும் at least once நம்ம இந்த ஒரு வார்த்தையை தாண்டி வந்திருப்போம். பட் இன்னுமே அதோட ஒரு இம்பார்ட்டன்ஸோ இல்லை அதுக்கான ஒரு ப்ராப்பர் அதை எப்படி அப்ரோச் பண்ணணுங்கிறதுலையோ ஒரு பெரிய டவுட் நம்ம எல்லாருக்குமே இருக்குது. ஸோ ராதர் தென் கைண்ட் ஆஃப் லைக் கூகுளிங் ஆர் ட்ரைங் டு அண்டர்ஸ்டாண்ட் இட், நம்ம வந்து எக்ஸ்பர்ட் கிட்ட கேட்டு தெரிஞ்சுக்கிறது இஸ் டெஃபினெட்லி தி பெஸ்ட். ஸோ ஐ எம் இன்க்ரெடிப்லி thrilled that we have Dr. Rupa here with us. Thank you, ma'am. Thank you so much for joining us. Ma'am is the HOD of Breast and Women's Imaging Intervention from KMCH, and she has specialized in advanced breast imaging technology, and in fact she's played a key role. Neriya technology இன்னைக்கு இந்தியாவுக்கு வந்திருக்குன்னா you have been responsible for that. Multiple research papers நீங்க author பண்ணியிருக்கீங்க. Thank you so much இன்னைக்கு எங்க கூட வந்து பேசுறதுக்கு. டெஃபினெட்லி breast cancer அப்படின்னு சொல்லும்போது ஐ திங்க் ஒரு 10 or 20 years முன்னாடி it was kind of like a rare occurrence ன்னு கூட சொல்லலாம். இப்போ it's become so common, we see it almost everywhere. I want to hear from your first doctor, in the early intervention, how important is that in the early imaging?
First of all, Nakshathra, thank you for asking for an expert hearing, about it. People in this era is always Googling and trying to find out some answers for their problems. Thank you for having me here first. Coming to your question, early intervention is very, very important. See, when it comes to cancer, ellarkum cancer ngra word keta, it is something equivalent to death அப்படிங்கிற ஒரு fear இருக்கு. That cancer phobia is so much because, ultimately it leads to an early death அப்படிங்கிறது தான் main fear. When it comes to certain cancers, நம்மளால் வந்து நம்ம ஹெல்த்தியாக இருக்கும் போதே நமக்கு சில ஸ்க்ரீனிங் டெஸ்ட் பண்ணலாம். There are only few handful of cancers where screening tests are available. Fortunately, breast cancer is one such cancer where when you look healthy, and even if a doctor examines you, sometimes the early cancer cannot be found. It can be done only with an early screening test. So breast cancer, we have something called mammogram, a specialized form of X-ray, where we detect cancer in stage 0. So that is why early detection is very important, because at the time la nama cancer detect பண்ணும்போது it is 100% curable.
Oh wow.
Yeah.
Okay. And in the early detection, how young should women start doing it, doctor? Because நான் கூட ரீசெண்டாக ஒரு full body medical health checkup போகும்போது there was like a specific number that they said. நீங்கள் அந்த வயசை தாண்டிங்கன்னா தான் it's included in the package or something like that. But what would you be your advice? How young should girls start getting these tests?
For breast cancer related to mammogram பண்ணனும் அப்படினா it should be at least 40 and above. Because younger breast will have more dense tissue ன்னு சொல்லுவோம். So mammogram will look just white. So அதனால வந்து we don't recommend mammogram as a screening test. That means I want to emphasize again the word screening, because as a healthy woman you walk in with no specific complaints, the screening test is recommended at the age after you reach 40. But if you have a breast related problem at any age, for example 35 yearsல lump வருது, 30 yearsல lump இருக்கு அப்படின்னா, ஒரு கட்டி நம்ம breastல feel பண்றோம்னா, you can always go and get that tested.
Okay.
You shouldn't say it's like 40 because I said 40, we'll wait for 40, you won't get. Because cancer in young in India has become very, very common.
Yes.
We do see cancers in the women who are less than 42. But as a screening test, we recommend it after 40.
So women younger than 40, how do you think they should examine themselves? How often should they examine themselves? Adapati, can you just elaborate?
There is something called self breast examination. In Tamil, we call it as Marbaha Suya Parisodhanai. You can examine your breast after the age of 25 every month. So it takes a couple of months to understand your own lumps and bumps.
Okay.
You know, and breast because of feel of the breast changes continuously throughout the month. You know, every woman who's watching here will know that.
Yes.
Periods ku munnadi or 15 days munnadi lende you can have heaviness in the breast, you feel some lumpiness in the breast, and all that is normal. It's because of the hormonal changes. So we recommend to do self breast examination preferably within the first 10 days of your menstrual cycle. So அந்த டைமில் breast நம்ம எக்ஸாமின் பண்ணும்போது breast will be soft. So there are good medical videos available in the net to know how to do a self breast examination.
Okay, maybe
so
you can share a link with me and I can put it down in the description.
So two things, it takes couple of months to understand your own breast. So you don't have to too much worry about those small lumps and bumps that you feel in the breast.
Okay.
And do self breast examination regularly within the first 10 days of your menstrual cycle.
Okay, so within the first 10 days பண்ணும்போது, if they find a lump, you're saying they don't have to be alarmed right away?
No. Small lumps, கொஞ்சமா ஒரு thickening breastல இருக்கிறது நினைச்சு பயப்பட தேவையில்லை.
Okay.
But if they feel the lump, obviously they have to get that checked.
All right. And is it like அது painful-ஆ இருந்தாதான் you should be worried? Or how does that work, doctor? Any lump you find, do you think it's important that they go and approach a doctor or speak to a doctor or something like that?
Okay, I'm so glad that you brought up this painful lump.
Okay.
Because in my practice, a lot of women are under myth that, you know, cancers will present as painful lumps. But unfortunately, painless lumps are the most worrying ones. Okay. So நிறைய பேர் for several months they will be waiting. எனக்கு வந்து பெயினே இல்லை, இப்போதான் எனக்கு பெயின் ஆரம்பிச்சுது, அதனால I'm coming to you அப்படின்னு. What happens is in early breast cancer in stage 0, 1, 2, the breast cancer will not be painful at all. And not the benign cancer, benign lumps, which we call it as non-cancerous breast lumps, also will not be painful.
Okay.
So you cannot really, attach those pain factor to your lump to call it as cancer.
Okay.
Across, I have seen across the socioeconomic status, across the educational status, somehow every woman has a myth that pain and cancer and lump, they are interlinked. Unfortunately, it is not. Only when the cancer is very advanced, breast fulla spread ஆகும்போது மட்டும்தான் வந்து breast cancerல வந்து pain இருக்கும். So if I would say, you take home only few points, this is something that you really want your followers to take it, because painless lumps in the breast can be cancer. Most of the breast cancer lumps are painless.
All right. So if we've discovered a lump, what should be the next step? Because at the end of the day, women are really, like, breast is definitely a private part. It's not something that they will go ahead and discuss with everybody without a stigma. Should they go to their gynecologist? Should they go to their general physician? Or should they directly approach an oncologist? Like, which department should they go to? How should they, go about it in case they are under some confusion?
Yeah. Unfortunately, not many women in India, or I would say in many part of Asia, are comfortable talking about their breast-related problems, even to a medical person. So, what we had done, keeping that in our mind, we in our setup, I would say that most of the interactions throughout their first consultation, workup, and discussion we make sure that women doctor is in contact with the women who comes to us, so that they are made absolutely comfortable to share all their worries and their concerns about their breast related problems. To whomever doctor they actually go and meet, it's not a problem, whether it is a gynecologist or a surgeon or an oncologist or a breast specialist like us. What is more important is, do not ignore, ask for a test. At any point of time, from any point of your life, when you have a breast lump, don't just get reassured just by a clinical examination. Lot of time they end up meeting their doctor who are comfortable with and who may not be an expert in this, and they get falsely reassured also. One second, at that point of time it would mimic like a normal tissue or a normal lump, but on the reassurance and the lump grow analo, you cannot take it. I met the doctor 6 months ago. At that time it wouldn't even look like a cancer. You can't blame the person who had examined them also. But when it is growing, when it is showing a change, don't get reassured. Na appa kaamichiten adanal enakku inume I think this is a normal lump appdin nenikka kodadu. So when it shows a change, even if you have consulted a doctor, even if you have examined, investigated, go back and ask, I'm seeing a change. Can you re-examine and start from the beginning?
Okay.
That's also very important. These are some things like the women myths that I've been practicing breast imaging and with the patients for more than 20 years now, and these are the common mistakes the women do, and they really miss the chance of complete cure because of all these.
Okay. And is it possible to get breast cancer but not feel any lump at all?
Absolutely. That's why we say it's screening.
Yes. So in that case, they only after 40 you would recommend them to come regularly. Adukku munnadi, is there chances for women to kind of like develop it?
There are chances to develop it, especially when you have a strong family history of breast cancer, certain ovarian cancer, colon cancer, and the madri genetic related cancers irukum. Previous generations வந்து genetic related workup பண்ணிருக்க மாட்டாங்க. So they can actually come for a consult and saying that I have got a very strong family history of breast cancer. Is there any way to check this?
What is very strong, doctor?
You have your first degree, your mother, your sister, or else your periyamma, atte from maternal side or paternal side, your party, anybody,
like
your blood relatives. One first degree, one, or if you have a second degree, next circle la vandu 2-3 people are getting detected, of that, they have detected at a very early stage, they have died of breast cancer, they have died of ovarian, or when you have a very strong family history of multiple cancers, different types of cancers. I think there are medical advancements now to check whether you carry any genetic mutation. So everybody knows Angelina Jolie, right?
Yes.
Where she had a prophylactic removal of her both breasts because she had a genetic mutation called BRCA, which is very strongly associated with breast cancer. Not just BRCA, there are many more mutations, because this became very famous because a celebrity had it. Following that, so many people who were carrying those genes underwent prophylactic. We say cancer varathukku munnadiye they removed their breast. So that much of an effect she had because it was so popularized at that time. So there are genetic mutations which are associated with breast cancer. So when you have a family history, even without before getting any symptoms, you can meet the doctor, get it consulted. We have geneticists to actually see whether they are all interlinked, and we can do a small blood test.
Okay.
To see
so
whether
it's just a blood test.
It's just a blood test to see whether you carry those genes.
Okay.
If they carry those genes, even for those women who are less than 40 years, we recommend there is a different pathway for screening for them also.
Okay.
So we know that they are more prone to get cancer. We know that they are more, they can get it in a younger age group. So we have a different screening protocols for them.
All right. And what would this cost, doctor? Like, be it this blood test to screening, will it be really expensive? Is that something that women should factor in?
Screening genetic test would cost a little bit more. It will be in like 30,000s and odd.
Okay.
But screening mammogram is not very expensive.
Okay.
It costs somewhere in different technology mammograms are there. Based on that, it may cost somewhere from 2,000 to 5,000.
All right.
Yeah.
And idellame it is available in South India, in Tamil
course,
Nadu.
Of course,
Okay.
of course. All the government hospitals have mammograms now. All the tertiary care hospitals, private hospitals have got mammogram. Most of your scan centers have got mammogram. So accessibility to these tests, especially in Tamil Nadu, is definitely not a challenge.
Oh, lovely. And you have played such an important role in that, I'm sure. So thank you so much for that. இப்போ நீங்கள் ஏற்கனவே சொன்ன மாதிரி ஃபேமிலியில் ஒரு ஹெரிடிட்ரி இருக்குது, லைக் ஃபர்ஸ்ட் blood relative இல்லைனா நிறைய cancer related cases உங்கள் ஃபேமிலியிலே இருக்குன்னு if you have come across, are there any lifestyle changes that you can make that may avoid it, or is there something that you might do that might make you more prone to it? அந்த மாதிரி ஏதாவது நீங்கள் is it something that you would like to elaborate on?
The increase in incidence of cancer in India is also attributed significantly to change in lifestyle.
Okay.
Yeah, we have adapted so much of Western culture now. So, like smoking, drinking, not having a proper weight, obesity is all linked to the risk for breast cancer. Obesity is very strongly related, especially the postmenopausal obesity. So, the menopause attain panadukku appuram, if you don't have a good body mass index, you are in the obese side, because all those fat cells also secrete hormones. So it is like you are exposed to hormones for a longer period of time, and so they are associated with breast cancer. And for young, they say, the breast gets complete development only after your first pregnancy and feeding. So if you postpone that beyond 30 years, it is also considered as one of the risk factor.
Okay. I was actually going to ask you that itself, because ipo I think with women and like the focus on careers and choosing your own kind of a path in life, I think parenting vandu oru choice madriye maariduchu, where it's not necessary like இந்த வயசுல ஸ்கூல் முடிக்கணும், இந்த வயசுல காலேஜ் முடிக்கணும், இந்த வயசுல குழந்தை பெத்துக்கணும்ங்கறத தாண்டி women's focus has shifted. And of course medically there is so many advancements that help them have a pregnancy later on as well. But in terms of this, what would your advice be to the young girls? Like is pregnancy and breastfeeding a child all helping you to kind of avoid breast cancer in life?
Yes. It reduces the risk. I wouldn't say that, this இதை பண்ணல அப்படின்னா 100% உங்களுக்கு பிரெஸ்ட் கேன்சர் வரும், இதை பண்ணியிருந்தால் 100% உங்களுக்கு ப்ரொடெக்ஷன் இருக்குன்னு கிடையாது. பிரெஸ்ட் கேன்சரை பொறுத்தவரை தேர் ஆர் சம் ரிஸ்க் ஃபேக்டர்ஸ். இது பண்ணாமல் இருந்தால் யோர் சான்ஸ் ஆஃப் கெட்டிங் இட் இஸ் ஸ்லைட்லி மோர். இஃப் யூ ட்ரிங்க் ஆல்கஹால், இஃப் யூ ஹாவ் அ வெரி ஸ்ட்ரெஸ்ஃபுல் லைஃப், if you are overweight, the chance of getting a breast cancer becomes higher than another woman who is not drinking, who is having a health. Okay. That does not mean that, if you, I also have, when we disclose that, to the women that you have this lump, it turns out to be cancerous அப்படின்னு சொல்லும்போது, why did I get it? I breastfed my children, I had 2 kids, I breastfed them for 2 years, I have a very healthy weight, I don't have a family history. Still we do not know why women get breast cancer in those group of women patients. So there are risk factors. So I would say, maintaining an ideal weight, having a healthy lifestyle, not having alcohol, not smoking, trying to complete your breast development, which happens only with breastfeeding before the age of 30, at least your first pregnancy before the age of 30, breastfeeding them, all that actually helps, protects you from. But it's not a guarantee that, you wouldn't get that. So there are so many things in medicine, still we do not know why we get it. Yeah.
And I think women சொல்லும்போது in general as well, right? Everybody is into skin care, body care, and like, நீங்க சொன்ன மாதிரி தான் அந்த western culture adapt பண்ணி, there are so many different bifurcations as well. And இப்போ நீங்க இந்த skin care குள்ள பாத்தீங்கனாலே so many papers and articles come out saying இது carcinogenic, இந்த product நீங்க if you use it over a span of couple of years you might get cancer or something like that. What is your take on all of that? Do the kind of body products that you use, the skincare products that you use, make you more prone to cancer?
Why only skin products? The food that we eat, the pesticides that we use, the air that we breathe, everything is carcinogenic now. So that is the alarming, that is why we get alarming increase in cancer incidence overall across the globe.
Okay.
It's not just one. Everything is with pesticides. Everything is with chemicals. So not just breast cancer, cancer all over the body. Certain conditions like autoimmune disorders and so on. All that is related to the food that we eat. So I don't blame only the cosmetic industry.
I'm glad.
Everything that we do has some carcinogenic product within.
But how do we approach this, doctor? Like, how
I
do
don't think. Maybe you should go back to village and do only organic farming and live there.
I know.
That would help. Breathing clean air, eating what you produce, and having only natural creams may help.
But that itself is scary. Like, to be
Yes.
honest, like, even for myself, right? Even this morning, when I had to put on perfume, I was so scared because I keep seeing these videos that say, perfumes kind of like give you some sort of a hormonal imbalance, which could end up giving you so many things. I might not be well versed in the medical terms, but all of this kind of scare
Everything.
you as well.
The food that you eat, if you say, for example, you eat meat, everything is hormone injected poultries right now. So that's why even the age of menarche, that is when you get your first period, has shifted now. It's no more 16, it's no more 13, we get it in 10, we get it in 8.
Yes.
That's because all the hormones that we have it in our food contributes it.
My God, what a scary world.
That's totally a different
we
topic to
live
deal
in.
with.
Absolutely. So now we've spoken a lot about imaging, screening, and everything that kind of, probably runs in our minds before it is identified. Now, when somebody has been diagnosed with it, we've identified that they have breast cancer, what do the treatment options look like? Generally in the chemotherapy, radiation, I think idella and the konja common terms are, and the people have some idea what it is. But ippo, what is like the medical advancement in that? How does treatment go ahead? Ippo, if they have breast cancer, does that mean their entire lifestyle will change? They can't continue working, or they can't go ahead about their routine? Can you tell us about that, please?
Yeah. So, for example, when we detect cancer, which is very early through screening, the most important thing that every woman should know that அந்த மாதிரி சின்ன கேன்சருக்கு வந்து you don't have to remove your entire breast.
Okay.
So that is something, everybody is scared of when it comes. You're losing your part of your body, because of cancer. And that is one of the main reason they don't even come. Let me die rather than losing it. அப்படினு நிறைய பேருக்கு ஒரு fear இருக்கு. So when we detect cancer, it's not equivalent to, you're going to get your breast removed. Most of the times, we may not need to. ஸோ சீக்கிரமாக நம்ம கண்டுபிடிக்கிறதோட அட்வான்டேஜ் வந்து நம்மளோட ட்ரீட்மெண்ட் உடைய சிவியரிட்டியும் கம்மியாக தான் இருக்கும்.
ஓகே.
ஸோ வெறும் கட்டி ப்ளஸ் சுற்றி இருக்கிற கொஞ்சம் நார்மல் பிரெஸ்ட், விச் வி கால் இட் அஸ் breast conservation surgery அப்படின்னு சொல்லுவோம். We conserve the breast, we remove only the cancer.
Okay.
So that is very much possible now.
This is நீங்கள் சொன்ன அந்த ஸ்டேஜ் 0.
Stage 0, stage 1, stage 2க்கு கூட பண்ணலாம்.
Okay.
Yeah. Up to stage 2, which is like less than 5 centimeter cancer and so on. அது வரைக்கும் கூட we can do breast conservation surgery, which is very much possible. There is no difference in the outcome. breast ரிமூவ் பண்ணாலும் சரி, கேன்சரை மட்டும் ரிமூவ் பண்ணாலும் சரி, ரெண்டு பேருடைய அவுட்கமும் ஒரே மாதிரி தான் இருக்கும். It's been proven with so many research and trials that there is no difference. Okay. So we don't have to lose the breast one. And not all breast cancers are the same. The aggressiveness of the breast cancer from one person to other are different. We have subtypings of breast cancer as well. So based on that, there are several additional treatments. So cancer surgery, for example, breast la vandu cancer illada lumps varala, which we call it as fibroadenoma, which we remove it with a pinhole procedure.
Oh.
You don't have to even undergo a surgery, scar, edume illama we can get that done also.
Okay.
That is for a non-cancerous lump. Cancer lump we will have surgery, and then what happens is surgery removes the cancer from the breast. But microscopica நமக்கு வந்து நம்ம blood circulate ஆகுது உடம்பு ஃபுல்லாக. So some cells could have passed through any part. So that part வந்து the chemotherapy takes care. Chemotherapy is given into the blood. Okay. So it circulates all over the body. So that gives your long-term survival. Okay. So another thing everybody is scared of is with chemotherapy, because they lose the hair.
Yes.
எனக்கு பையன் கல்யாணம் இருக்குது, என் பொண்ணுக்கு டெலிவரி இருக்குது, கல்யாணம் பார்த்துட்ருக்கோம் for the for their children. அதுக்காகவே நிறைய பேர் வந்து they will postpone it. Because acceptance from the society, acceptance from your own family, acceptance from your relative, still cancer is not accepted well. Unfortunately, instead of supporting the women, we really hurt the women so much. So அதனால நிறைய பேர் வந்து they don't come early. கட்டின்னு தெரிஞ்சாலும் they don't come. So chemotherapy is something which gives a long-term benefit. So that is one. When we remove the breast, many a times we may not give radiation. So certain situations, part of the breast, அதாவது lump மட்டும் remove பண்ணும்போது rest of the cells which are microscopic இருந்தாலும் radiation takes care. So you need to know why each treatment is also important.
Yes.
You remove your cancer through surgery, you kill the cancer cells in the rest of the breast by radiation. The cancer cells could have circulated all over the body and would be settling somewhere. So that chemotherapy takes care. To certain type of breast cancer, we also give something called targeted therapy. Okay. Certain aggressive type, that is also like a chemotherapy. We give it through injection, where the targeted therapy takes care. That gives lot of benefit. And certain cancer have hormone receptors. So we give them tablets to reduce the risk for the rest of the life. So we give it for 5 years, we give it for 10 years, the hormonal therapy. So it's a combination. In the எல்லா காம்பினேஷனும் உங்களோட சப்டைப் ஆஃப் கேன்சருக்கு எது சூட்டபிளாக இருக்கோ எல்லாத்தையும் நம்ம கரெக்டாக எடுக்கும்போது தான் we can say that you get back to your normal life. You can't skip one or two.
Understood. So the follow-up is very important.
Why are we doing it? Because those are the advancements in medical treatment that gives you, that removes that cancer is no more lethal. Cancer is not equivalent to death. You can lead a normal life. அப்படிங்கிறது இது எல்லா treatment only helps.
Okay, so it's like a combination. And you'll identify in the patient க்கு எந்த மாதிரி combination work ஆகும் அப்படின்ட்டு. So ஒரு தடவை if you have identified a lump and you have removed it and you follow through with this treatment as well, how frequent should they come back and get screened as well?
Every year.
They
just come back as every year.
Okay, so it's an annual screening. Above 40, and once you've been detected with cancer,
once you complete the treatment, they come to us every year again for screening.
Okay, and idukku munnadi kuda neenga address panninga the support that comes with the people around. Like it's not like namakku cancer irundha mattum illa, namakku therinjavanga illa நம்ம ஃபேமிலில இருக்கிறவங்க ஒருத்தங்களுக்கு வந்துச்சுனா, what sort of support do you think the rest of the family or the society can offer them?
This is a very very reality thing. Lot of women are still financially dependent. Sometimes a choice of surgery even is not given to her, unfortunately. The son or the husband decides nobody asks her what she wants. They take decision for them. Many a times they say, let her wait outside, it's difficult to, I will disclose. I said, no. She has to know what she is going to undergo. I can clear all her doubts rather than you. I want to talk to her. Anybody else, if you want, can sit. So that is the reality in our, many a times we just totally ignore the women just because they are financially dependent. They also have a heart. You have to ask them what they want, whether breast removal is okay for them. You can't take a decision for a woman. The women needs to be asked. Unfortunately, in Indian practices, we don't even give importance to the women who are suffering from cancer, that she has to know what she is going through and what she wants. That even that level of support is not given. And there are quite a lot of family who supports them very well as well. So it is not a taboo. It is not just because a woman has developed a cancer does not mean that her family should not be included. அவங்க பையனையோ கல்யாணம் பண்ணா பெரிய டேஞ்சர் அப்படியெல்லாம் ஒன்றும் கிடையாது. That acceptance have to come, and the acceptance and support இருந்தாதான் women will come forward. They will I always tell, women have to put their health as their first priority, which most of the women fail to do. If you don't take care of your health in your crucial period of like 40 to 50, where your family needs you most, and you say my family other மற்ற எல்லாத்தையும் உன பையனோட எக்ஸாமு பொண்ணோட டெலிவரி எல்லாத்தையும் நம்ம முன்னாடி வச்சுட்டு நம்மளை பின்னாடி வச்சுட்டே பேக் சீட்டில் தள்ளிட்டே இருந்தோன்னா we will the whole family have to lose you finally. You know, taking care of yourself as your first priority is definitely not being selfish.
Well said.
You know, it is, you have to take care of yourself first to take care. You can't give love from the empty vessel. You have to be full. Your health has to be good. Only then you can support your family well. So always we have a guilt as a woman, you know. If I eat first before the child, it is selfish. No, it is not. You have to take care of yourself first so that you can happily handle the tantrum of the child.
It's like flight la the oxygen mask varunla. First put on your mask
and then give it.
Someone.
Every time we fast to and then run around with the child and we lose the patience ultimately.
Correct.
If you take care of yourself very well, you will be also able to give lot more love and care to your family. So taking care of yourself is certainly not a selfish thing.
Absolutely. You know, what happens is in the madri panikte irundha, the family also gets conditioned to being the first priority, and then when something actually happens to the lady of the home, avangalku adu onnu or periya vishayama theriyama poidlam. I have another question, doctor. Like, let's say neenga sonna madri prioritize pandrathu financially, of course that needs to be done. But otherwise, if there is somebody from a very lower income group, இப்போ இந்த cancer treatment அவங்களால afford பண்ண முடியாதுன்னா, is there like any sort of an aided facility that's available for them, or like an NGO that they can approach in case you know, they're not able to fund their own cancer treatment, or anything else, any sort of a scheme that they can avail, or anything that you know of?
Tamil Nadu actually has got a very well health infrastructure even at government colleges, I would say. Okay, they have got a complete if for example Keelpark Medical College has got a dedicated breast center as well. With not just low end equipments, they have got the high end equipments, and all the care that is possible in a private hospital is possible in a government hospital also.
Okay, that's wonderful to hear.
Yeah. Our Tamil Nadu medical colleges have a very good infrastructure. Most of the district hospitals have got mammogram. They have an oncology department. Ella care that is possible in a private is also possible in our government setup.
Okay, that's great.
Yeah.
And I have another question. Like, I still remember when I hit puberty and I went to buy bras for the first time, right? Anga or akka irundanga, she told me in the vayasula you should not wear padded bras, you should not wear underwired bras and all of that. I'm just like being very honest with you. And she said idella pota future la cancer varu or something like that. I remember at such a tender age, it stuck with me in my head, and she had a very big influence on me. Is there something like that, or is there anything like the kind of clothes you wear, does that indicate?
No. It has no relationship with the type of the bra, the wired bra, non-wired bra, the size of the breast. A lot of people also think, you know, if you have a large breast, you can have more chance for getting cancer. Small breast kirkadu. All these are nothing. They are just a myth.
Okay.
Myth, yeah.
And another thing that I came across, I wanted to again get clarified by you, that breast cancer does not occur just in women. Is that true? There have been some rare occurrences.
Yes, of course. We have male breast cancers also.
Okay.
Yeah, though the incidence is very, very, very less, but breast lump in men is mostly cancerous.
Oh.
Yeah. அதனால வந்து men வந்து இக்னோர் பண்ணவே கூடாது ரொம்ப, பிகாஸ் அவங்களுக்கு லம்ப்னு இருக்குது, ஒரு நிப்பிள்லேருந்து டிஸ்சார்ஜ்னு இருக்குது அப்படின்னாலே வந்து தே டெஃபினெட்லி ஹாவ் டு செக் வெரி ஏர்லி. பிகாஸ் அவங்களுக்கு பார்த்திங்கன்னா நாங்கள் வந்து 25 இயர்ஸ்லேருந்தே மேமோகிராம் பண்ணிவிடுவோம். Yeah, and the BRCA genes that we said, men also can carry BRCA gene. And we have, I have seen men with BRCA gene positive breast cancer also running in families, father and son getting it. So that's also possible.
That's a bigger stigma then, no doctor? Yeah. They'll be even more hesitant than women.
Plus நிறைய breast tissue இல்லாதனால சீக்கிரமா அது நம்ம பின்னாடி chest wall அதெல்லாம் கூட சீக்கிரமா it can spread it.
Okay.
So breast cancer in men, though rare, will be like quickly will spread also.
So is this the same protocol that they should follow as well? Maybe come for a gene testing and then see if they're carrying a gene?
No, we actually don't recommend widespread screening for men because the incidence is extremely low.
Okay.
Lump irukku அப்படின்னா நாங்கள் வந்து ரொம்ப யங்கர் ஏஜ் குரூப்பில் வந்ததுன்னா வீல் சப்ஜெக்ட் தெம் ஃபார் ஜெனட்டிக் டெஸ்டிங் அண்ட் தென் வி செக் வெதர் தே ரன்ஸ் இன் ஃபேமிலி
லம்ப் ஐடென்டிஃபிகேஷன்
இருந்தால் போதும். தே ஹாவ் சம்திங் கால் கைனகோமேஷியான்னு சொல்லுவோம். தே கேன் டெவலப் பிரெஸ்ட் டிஷ்யூ பிகாஸ் ஆஃப் த ஹார்மோனல் சேஞ்சஸ் தட் கேன் ஹேப்பன் இன் தெம் பிகாஸ் ஆஃப் சர்டன் இல்னஸ்னால அவங்களுக்கு வந்து ஈஸ்ட்ரஜன் ஹார்மோன்ஸ் அதிகமாக இருக்கிறதுனால தே கேன் டெவலப் சம் பிரெஸ்ட் டிஷ்யூ. அதுவும் லம்பாக இருக்கும். ஸோ we can't differentiate many a times அது வந்து just breast tissue development in men or it is a cancerous thing. So அதனால் the threshold for investigation, the threshold for doing a biopsy will be very, very low. We don't miss even one, because it's very rare.
Correct. Yeah. Okay. And another thing that I wanted to ask you, doctor, was that of course cancer and like அது பத்தி இன்னுமே அந்த வார்த்தையை கேட்டாலே ஒரு பயம் எல்லார் மனசுலயும் இருக்கு. Though it's become a little bit more common now, it takes a toll on people, the families, everything. Does it take a toll on you when you see this of day course. In and day out? How do you handle it? I mean,
we get used to it. We feel bad, we actually have to have a little bit of an emotional detachment. Illana romba kashtam. But we do see it feels really difficult to, certain families will very young women getting breast cancer. Nariya kashtathuk nadula they'll get back to back rendu moonu cancers. Husband would have just diagnosed with something, or husband would have just passed away with some cancer, and this lady will now come and say, why did you not come? No, he was in the deathbed, I was just waiting, now I've come. So we listen to such things day in and day out, and we have to get used to it. We can't have so much of an emotions attached to it. Detached other, we have to handle it. Otherwise, it takes a toll on us as well, right?
A salute to your strength, doctor, because just having this one conversation is like touching me in so many ways. To be able to do this day in and day out, you must be an incredibly strong lady. I went through an incident recently that I wanted to discuss with you as well. Now in the hospital to visit a relative who had just gone in for surgery and had come out, and the OT la ஒரு recovery room இருக்கும் இல்லைங்களா, அங்கே உள்ளே போய் அவங்கள பார்க்கணும் சொன்னாங்க. ஸோ அவங்க அனஸ்தீஷியாலேருந்து வெளியில் வந்துட்டு இருந்தாங்க. அண்ட் அப்போது அங்கே இருந்த ஸ்டாஃப் வந்து அவங்கள கேட்குறாங்க, வாட் வுட் யூ லைக் டு ஹாவ் அண்ட் அவங்களுக்கு கொடுத்த 2 ஆப்ஷன் வாஸ், வுட் யூ லைக் டு ஹாவ் காஃபி ஆர் வுட் யூ லைக் டு ஹாவ் ஜூஸ். அண்ட் லைக் ஜென்ரலாக நான் இப்போ மறுபடியும் கேள்விப்பட்ட ஒரு விஷயம் என்னென்னா, நம்ம காலையில் எழுந்து எம்டி ஸ்டமக்லேயே காஃபி குடிக்கக்கூடாது, தட் மேக்ஸ் இட் வெரி அசிடிக் or சம்திங் லைக் தட்னு சொல்லுவாங்க. அவங்க சர்ஜரியிலேருந்து ரிகவர் ஆயிருக்காங்க அந்த ஹாஸ்பிட்டலில். தே ஹேட் ஆக்சுவலி ஆஸ்க்ட் நீங்கள் காஃபி குடிக்கிறீங்களான்னு. ஸோ வி செட் ஓகே ஃபைன், லெட் ஹர் ஹேவ் ஜூஸ் இன்ஸ்டெட். ஆனால் ஜூஸ்னு வரும்போது தே brought like a tetra pack. அகெயின் டிப்பிக்கலாக இந்த ஆரஞ்ச் ஜூஸ்ன்னு போட்டு அட்ராக்டிவாக ஒரு டப்பாவில் கொடுப்பாங்க. பட் அதில் ஆரஞ்சே இருக்காது, சக்கரை தண்ணி தான் இருக்கும் சொல்லிட்டு அது கொடுப்பாங்க. இந்த மாதிரி இருக்கிறதெல்லாம், இஸ் தட் ஓகே ஆர் லைக் isn't that something that's not how it's supposed to be?
I am not sure about that because we give only freshly squeezed juices in our hospital. So I don't know about the hospital that you are talking about.
Okay.
But coffee is okay because we would actually, surgery is a stress, so we actually give them anti-ulcer medications kuduthirpom.
Okay.
So it wouldn't hurt because that will take care of her acidity very well. Because surgery நம்ம ஏதாவது அசிடிக்கா இன்டியூஸ் பண்ணுற மாதிரி குடிச்சாதான் நமக்கு வந்து அசிடிட்டி வரணும்னு ப்ராப்ளம் இல்லை, அவசியம் இல்லை. ஸோ ஈவன் இஃப் யூ ஹாவ் ஸ்ட்ரெஸ், mental stress or a surgical stress, like how your relative was, somebody was there, we give anti-ulcer medications which will take care of her acidity. So having a coffee in that is definitely should not be a problem.
It was just a moment where I was stuck, and I mean, again, I'm being very honest with you. I was like, how does someone make a decision like that? Like, if in case they're put in such a situation.
If my mom is asked, she would definitely ask for a coffee.
I know, anything to kind of like relieve the stress.
Yeah, there are so many people, who even on the day of surgery, to skip the morning coffee is the biggest punishment for them. As soon as they are awake from anesthesia, they would say, I want coffee back, just to have that otherwise அவங்களுக்கு ஒரு ஹெட்டி ஃபீலிங் இருக்கும், அது ஒரு மாதிரி அன்கம்ஃபர்டபுளாக இருக்கும் டு ஹேவ் த காஃபி ஃபர்ஸ்ட் இன் த டே as a first thing to drink in the morning. Yeah.
But in general, நீங்கள் ஏதாவது dietary restrictions கொடுப்பீங்களா if somebody is undergoing like cancer treatment?
We ask them to actually take a very healthy diet, especially when a chemotherapy is given. It is a very strong medication which not only kills your cancer cells, which will also attack your normal cells. Okay. So your immunity goes down. That's why we space the chemotherapy. so that your immunity and your normal cells comes back, your body recovers. அதுக்கப்புறம் தான் அடுத்த cycle of chemotherapy கொடுப்போம். So it's always good to have a very healthy diet so that your immunity is not compromised much, that we say. And then we also tell them not to go for a very crowded place when you're under treatment. All that because you're more susceptible to getting infection. And to have a healthy diet, more importantly, that's why I said the support from everyone is very important, because a more good mental health is also very important. நம்மளோட stress, நம்மளோட bad feeling இருந்ததுன்னா நம்மளோட immunity certainly gets affected. If you are in a very happy, supportive environment, your body also responds to treatment very well. That's why support from the family, having a very positive approach even if you're detected with cancer, is very important for a smooth recovery.
Okay.
Yeah, when I talk to the patients, I always tell them, you cannot avoid this situation. That is something which is not in your hand, but you have a choice whether to face it crying all through or to face it with a positive mindset. If you face it with that is in your hand, right? That nobody can control that. So if you approach it with a positive mindset, I'm sure you can sail through it easily, rather than why me nama அழுதுட்டே ப்ராசஸ் எடுத்துக்கிறத விட, it's okay, it has come, let's just face it. That really helps for the immune system as well.
Any patient experience that you can share with us, doctor? Anybody who's faced it very strongly? Anybody that you've come across?
Yes, so many women are very strong. So many, because I think women, you can call women as a very tender person and all that, but I think women are the strongest person because they handle stress, both mental and physical stress, much more efficient than men. People may agree, disagree. That's what I feel. When it comes to a stress, maybe at a very brief period she may be emotionally down, but once she accepts that she has to face it, I think she faces it with much more strength, much more grace, I would say. So not one, there are hundreds of women who had faced it very well.
Oh, I'm so glad. So again, breast cancer nu சொல்லும்போது immediately breast removal அப்படிங்கிறது தான் எல்லார் மனசுலயும் தோணும். அதை தாண்டி, is there any other treatment that is available? Like if there are younger women who come in for treatment and all of that, அவங்களுக்கு breast removal might be something that's taking them by a shock or something like that. So அதுக்கு ஏதாவது alternate
there are some options which are in the at the research level, which is called cryoablation of breast cancer in solrom, where we freeze the tumor.
Okay.
So it's available for a specific type of tumor, early cancers, ingu spread agada or a small size la irukradhukku vand it is available. But currently no sila approvals adukku varala, like where we can offer it for all women who are diagnosed with an early cancer in a specific subtype, still not available. But in an elderly patient who is not fit for surgery, who cannot undergo surgery, surgery becomes more riskier for life, we have done cryoablation, so where you can actually kill the cancer cells within the body, but it's like an OP based procedure madri. It's done under local anesthesia and that is possible.
Okay.
But still not available currently for all spectrum of ages. Who are surgically fit, we still offer them surgery. For surgically unfit, there are options that are available to treat the cancer. The other part is young women, where lumps not always need to be breast cancer. And we talk so much about cancer, though, so I'm sure your followers must be panicked by now. But I also want to give them a very positive thing, that 8 out of 10 lumps, are non-cancerous.
Oh.
So you don't have to worry.
Oh, yes. That was needed, I think.
We talk so much about cancer and finally they all may think, lump irundale that is equivalent to cancer. It's definitely not. There are nariya non-cancerous lumps breast, it's possible. Some we will be able to just tell you just by the scan that it is not a cancer. Okay. Sometimes we may have to do a tissue sampling, biopsy panni adu cancer illanu prove panna vendirukkom. So not all lumps are cancerous. Another spectrum that we see is in a younger age group, like like less than 20, less than 30, they get a very common non-cancerous benign lumps in solvom. That's called something called fibroadenoma. So now again eppadi namakku vanda cancer surgeries surgery lessa பண்ண முடியுமோ இது வந்து it's there for quite some time. What we call it as a vacuum assisted excision of a fibroadenoma சொல்லுவோம். So you don't have to have a surgery, you don't have to have a scar in the breast, especially there's so much concern about having a scar in the breast in young girls, you know. So அதுக்கு வந்து we have a procedure, pinhole procedure, we call it as a scarless procedure called vacuum assisted excision. So that is quite accepted, unlike the other cryoablation that we were talking about, and it has become a standard of care, Madri. So when you have a non-cancerous young girl's lump, they want to get that removed, ask that, you know, is there a, that is something nariya perukku theriyirudilla.
Very true.
That is, people are not aware when they come to us with multiple scars and they எங்களுக்கு முன்னாடியே தெரிஞ்சிருந்தா நாங்கள் வந்திருப்போம், எங்களுக்கு தெரியலை. So that awareness also is not there. So surgery இல்லாமல் நீடில் வந்து நம்மளால் க்யூர் பண்ண முடியும், which is more common. You know, we talk so much about cancers and treatments and suffering. There are also some good things we can talk.
Yeah, the awareness is what is important. If you
Yeah.
have a lump, just get it checked. It's
Yeah,
better to be sure what it is and get professional advice for sure. And also it's important to be aware என்னென்ன மாதிரி treatments இருக்கு. So kind of like, you know, go ahead and get to know about it so that you can make a wiser decision as well.
Yeah.
And of course, cancer treatment kulle, when you get into it, and even when you get out of it, you kind of like beat whatever has been troubling you. It leaves like a lot of physical scars, maybe, even if it's not the kind of scars I'm talking about. Emotionally, physically, you've gone through so much, Ilingla. So once that's done, to kind of like find your space and get your support, are there support groups that they can go and approach?
Yes.
And be a part
Every hospital now who treats large amount of cancers have got a cancer support group. Okay. So இப்போ என்னோட ஹாஸ்பிட்டல் எடுத்துக்கிட்டோன்னா we have a cancer support group where not only one type of cancers, you know, breast cancer, we have a meeting where cure ஆன patients will come and give emotional support to the persons who are undergoing the treatment. So நம்ம எவ்வளவுதான் நம்ம assurance கொடுத்தாலும் it's nothing like from a person who has undergone the same thing. So that gives them lot of a positive outlook to go through that. So we, apart from psychologist help, we also have patients who are supporting their fellow patients as well.
Wow, that's so beautiful.
Yeah, I'm sure all the hospital has that. We have a cancer support group which comprises of doctors, physiotherapists, occupational therapists, psychological support. We have clinical psychologists, psychiatrists, and most importantly, the patients.
That's
you know,
lovely.
and they listen to the stories. You know, there are certain things which even we will not know, and everybody has got their own way of handling it, and they share their experience. You know, I also had the same thing, but I tried this. Do you want to try? So that helps them a lot. Like small day-to-day activies like challenges. அந்த அளவுக்கு நம்மளால வந்து unless you go through the process you will not be able to tell. So we comprise a large team of specialists and also the patients who actually support the fellow patients.
Oh, that's lovely, doctor.
Yeah.
Thank you so much. I think ரொம்ப insightful-ஆ இருந்தது இந்த conversation. There's so much that we got to know, and எல்லாமே ரொம்ப sweet-ஆ you made sure that we all understood what you were talking about, and it was such an honor talking to you. If there is like an advice that you can give to all the women out there, if there's something that you can share with them, it's your moment.
Yeah.
You can go ahead.
Most important is you take care of yourself first. Taking care of yourself is definitely not selfish. It's very, very important that you don't ignore your symptoms, you don't ignore your early screening. In the problem, not only to breast, anywhere in the part of the body, you say you go and ask for a medical help. And to the society or to your fellow women, be very supportive, don't be judgmental. You can support each other by sharing, you know.
Thank you, doctor. Thank you so much. And I think that was the whole point of this conversation itself. சில questions நம்ம மனசுக்குள்ள வரலாம், இதெல்லாம் ரொம்ப சில்லியான ஒரு விஷயம், இதெல்லாம் ரொம்ப சின்ன விஷயம், ஒரு லம்ப் தானே போனா போகட்டும் அப்படின்ற ஒரு மைண்ட் செட் இன்னுமே பெண்களுக்கு ரொம்ப அதிகமாக இருக்கு. I hope that through this conversation you kind of break that. உங்களுக்கு ஏதாவது ஒரு டவுட் இருந்ததுன்னா take a day off, go meet professionals. Again, I know Google has answers to most questions, but I still think that getting proper professional help and having having a human to human conversation, nothing beats that. இந்த கான்வர்சேஷன்ல இருந்து நான் நிறைய கத்துக்கிட்டேன். கண்டிப்பா உங்களாலையுமே உங்களுக்குன்னு ஏதாவது ஒரு விஷயம் இருந்ததுன்னா அதை ப்ரையாரிட்டைஸ் பண்ணி ப்ளீஸ் டேக் தட் டைம் ஆஃப் டு கெட் இட் செக்ட். அஃப்கோர்ஸ் ப்ரிவென்ஷன் இஸ் பெட்டர் தென் கியூர் எனி டே. ஒன்றும் இல்லைன்னு தெரிஞ்சிருச்சுன்னா நீங்கள் நிம்மதியாக காலப்போக்கில் உங்கள் வாழ்க்கையை லீட் பண்ணலாம். பட் அகெயின் மேக் ஷுர் that time to time you're constantly focusing on this. Ma'am சொன்ன மாதிரி we'll definitely link down how to self-examine yourself. Kindly go ahead and do that and take care of yourself. And if there are any doubts, feel free to put that in the comment section below and I will definitely pass it on to ma'am and be able to give you the answers as well. Thank you so much once again, ma'am, for helping all the women out there and for dedicating your entire life into that. First time ungala paatha odane I was like, how does she have like 20 years experience? You look so young. You've started at a young age and you're continuing to make this world a better place for all the women out there. Thank you so much for your continued service and wishing you all the best as well.
Thank you. It was an absolute pleasure. Thank you.
Thank you, ma'am.
Thank you.